Thank you for joining us today. My name is Steph Thompson. I am the Workplace Mental Health Advisor for Superfriend. And welcome to this episode or this session for Wellness by the Water Cooler. We were sort of keeping track of numbers. I've lost track of numbers. We've done lots of these over the past 13 months or so now. Before we get into things, I would like to acknowledge the traditional custodians of the lands that we are all joining from today. I am joining from Gadigal land. Please feel free to jump into the chat and let us know the names of the lands that you're joining from today. I'd also like to acknowledge that sovereignty has never been ceded. And I'd also like to acknowledge anybody who might be experiencing mental distress or poor mental health at the moment. Thank you so much for showing up today. I know it's not always easy to do, so I really appreciate we see you, and thank you for coming along today. So today's webinar is all about intergenerational mental health in the workplace. So the modern workplace has the potential to have 5 generations working within it in the coming years. Currently, there are 4 generations working within the workplace, any given workplace at any given time. And across these 4 generations, there are obviously different social norms, expectations, socializations. And as you would expect, you know, this really makes an impact on mental health outcomes, and they vary so much. So joining me today to talk about this really important and interesting topic, we have Dr. Mark Deedy from the Black Dog Institute. So Dr. Mark Deedy is research lead of the Workplace Mental Health Research Program at the Black Dog Institute and a senior research fellow at UNSW. He has worked in the field of mental health and substance use disorder research since 2008 and is an international expert in workplace mental health. He completed his PhD in 2015 through the School of Public Health and Community Medicine at UNSW and has led a range of projects at a coronial epidemiological and clinical level. His primary research interest is in prevention and early intervention of mental health disorders, improving access to evidence-based programs through technology, and the translation of research into practice, particularly in vulnerable populations, including young adults and high-risk workforces. He has extensive expertise in the development of psychosocial interventions, digital mental health, online service delivery, and clinical trial evaluation. Welcome, Mark.
Thanks, Steph. Appreciate that intro. It's always,
I just went with the whole thing because it was also impressive. Thank you so much.
Yeah, it's probably sounds better than it is. I mean, you throw in fancy words like epidemiological, and if nothing else, it ruins people's ability to say it right. So
just make it fun for you to watch us try to stumble through words. Thanks for that. No, it is very impressive, and you are very impressive. So thank you so much for joining us today.
Thanks for having me.
And also joining us to shine a light on our Superfriend data from the Indicators of a Thriving Workplace report is my colleague, Dr. Diane Shepherd. So Dr. Diane holds a Senior Research Fellow adjunct position at Monash University and has worked at Superfriend since August 2023 in her role of Research Program Manager. She has extensive research expertise accumulated from 20 years working in research roles that span a variety of disciplines from cognitive and neuropsychology, which is what her PhD was in, through to injury outcomes and behaviour change. Her postdoctoral years allowed her to further explore cognitive neuroscience with an amazing team at the University of Wales, Bangor in the UK. Since moving back to Melbourne in 2003, her research has been more applied with a particular academic focus over the past 12 to 13 years on psychosocial assessment, risk screening and early intervention in the context of personal injury compensation schemes for both physical and psychological injuries with the view to improving work and health outcomes. Welcome, Di.
Thank you. And also a mouthful. Sorry to do that to you, Steph.
You're both just so impressive. And this is what I think research and academic people have very impressive bios. So thank you. It's an honour to have you both here today. Just a couple of little housekeeping things. This session is being recorded and we will be sharing that recording out with our follow-up email, which will come out in the coming days as well. We'll go through a number of questions. First up, please put your questions in the chat. Probably better the chat than the Q&A. We've got my colleague Mel in the chat to answer any immediate questions that come up, and she'll be keeping an eye on the chat throughout the session. We'll have time for questions at the end, so please keep your questions coming through. Also, much of what we're going to be discussing in this session is related to our Indicators of a Thriving Workplace research, which is our Super Friends sort of flagship research project. It is the largest national work and mental health survey in the country. And our report for the 2024 survey report came out in March this year. My colleague should be putting, or will be putting, a link into the chat for you to download that report if it's of interest. So you can check that out on our Super Friend website. So to get us started today, Di, let's just start by doing a check on what that 2024 Indicators of a Thriving Workplace data has told us about intergenerational mental health at work.
Sure, thanks, Steph. Well, there was a wealth of information, as you can imagine, coming out of the most recent survey about intergenerational work and mental health. So it was actually very difficult to narrow it down to one or two key insights. But the first finding that emerged very clearly and quite strongly was that our younger generations are actually the most vulnerable to burnout and psychological distress. So generations Y and Z workers show quite elevated levels of burnout and psychological distress, higher than other generations within our workforce. To paint a clearer picture, over 1 in 4 of Generation Z workers fall into that severe category of psychological distress. And these are scores that are indicative of potentially serious mental illness. So if we go a slightly lower and include moderate distress levels, this increases to almost 80% of Gen Z and also Gen Y workers. So Gen Y reports similar levels of psychological distress, only slightly lower than Generation Z. And this is really in stark contrast to our boomer generation of workers, where only 4.2%, so less than 1 in 20, report severe levels of psychological distress. And if we look at our measure of burnout, it looks quite similar. So while 80% of boomer generation workers show no indications of burnout, over 1 in 2 workers within generations Y and Z are either at risk or burned out. So I guess there may be several key factors at play here that could contribute to the higher burnout and psychological stress as our key indicators of workplace mental health from the ITW survey. And the first thing that pops into our minds, particularly when thinking about burnout, is workload pressure. So in this context, perhaps the different types and levels of workload pressure experienced across the generations could be a potential explanation for those generational differences that we're seeing in mental health outcomes in the workplace. And when we look at these using our data insights, we see that workers in Generation X are most likely to report working in excess of 40 hours a week. And 42% of workers in Generation X believe that their workload is inappropriate. This looks quite similar for Generation Y, a very similar proportion also believing that their workload is inappropriate, although this drops for our oldest and our youngest workers. See that across Generations X and Y, for our self-rated workload pressure scale, that they're also scoring the highest, with Generation Z workers scoring the lowest for that measure. So if we're thinking about workload pressures, then it seems that they're not solely responsible for the burnout and psych distress challenges that we're seeing for our youngest workers. It's also perhaps important to consider the prevalence of mental health conditions in each of the worker generations and whether this is potentially playing a role in the susceptibility to psychological distress and burnout.
Yes.
So I believe Mark is going to spend a little more time on this, but our measure of lifetime prevalence of a mental health condition from our ITW survey and also self-reported mental health in the past 12 months indicate that, yes, actually mental health status is not an equal playing field across the generations. So when we look at mental health relative to 12 months ago, what is really interesting here is that despite the higher levels of psychological distress and burnout, the higher percentage of these youngest workers in our workplaces actually report better mental health relative to 12 months ago. So this is around 35 to 40% of Generations Y and Z workers reporting better mental health relative to 12 months ago.
Okay. Okay. So that makes me wonder, and this we can throw to Mark now because that's a really interesting point. You say that in the last 12 months, there's been much more claims for Gen Z compared to other generations. Is that what you mentioned?
I haven't as yet, but I will mention that. I haven't quite got to that yet, but I can, Seth. So what I wanted to share though before that was that these levels of distress and burnout clearly impact work outcomes like loyalty and perceived workability. So in terms of impact, another thing that our data clearly show is that psychological distress and burnout flow through to have considerable impact on work outcomes. So we might expect to see intergenerational differences in these work outcomes as well. So if we look at workability, so our ITW survey asked workers to self-rate their workability in the context of their lifetime best. Boomer workers are the stars here, with 67% or 2 in 3 reporting being able to work at a level that is near their lifetime best. Okay, so they're scoring really well. And this aligns with their lower burnout and distress levels. And perceived workability drops to only, working at their lifetime best, drops to only around 1 in 2 workers for generations Y and Z. So I wanted to leave you, and this is where I'm going to get to, so psychological claims. But the first thing, our measure of loyalty, which is intentions to stay with our employer, our oldest generations are the most loyal. Our youngest generations, much more likely to report intentions to leave. Generation Z show the highest intentions to leave, with 15% intending to move on from in the next 12 months from their employer. And if we include those who are unsure, that increases to 36%. So that's quite high. And Boomer generation and Gen X workers, approximately 80% intend to stay. So they're our most loyal workers. In terms of mental health claims, 4.2% report having made a mental health claim in the past 12 months. And this is the highest proportion of all worker generations. So this is Generation Z. And we see that decrease as the workers get older. So this comes down to only 1% intending to make a mental health claim, reporting having made a mental health compensation claim in the Boomer generation of workers. I'll leave it there.
Yeah, thank you, Di. I think that's really interesting, and there's so much data in all of this, and I should have said this at the beginning of the webinar, is that what we're not going to do today is dive into all the nuanced differences amongst all the generations, because we just don't have the time. So we're just talking about, obviously, the data, mental health status, and the sort of risks associated. And you made many interesting points. The ones that stood out to me around the language around loyalty, I thought was really interesting, because staying with an employer, or intent to stay versus intent to leave, the word loyalty suggests that's a really good thing, but we know that that's not necessarily a good thing. And there could be many factors as to why, say, an older person, a Boomer generation or Gen X, might decide to stay, whereas a Gen Z who's earlier on in their career might have lower intent to stay. And again, that's not altogether a bad thing, is it? That they might be looking for what else is out there, or might not tolerate poorer working conditions. So I think that's just something to sit on and think about as well. And then your point as well around those claims. So, the last 12 months, Gen Z has had the highest number of psychological claims. And this is sort of leading into a question for Mark, or a reflection for Mark, around back in the day, and perhaps the data was not as easy to capture, or there would have been different laws around it. But can we say, do you have any idea of claims that, say, the Boomer generation were making when they were in the same age bracket as Gen Zs are now? Mark, can you comment on that at all?
Thanks, Steph. I mean, as you sort of alluded to, I think one of the critical things here is the change in regulation. So it's very difficult to make these comparisons, because through that period, for some of the older cohorts, the laws are very different. I'm no lawyer, so I'll probably screw this up, but we sort of moved through this in terms of the compensation system, and it's obviously different state by state. And I'm being from New South Wales, I'm more familiar with that system. But it's gone through, stages of change, with a major change for us back in 87. And then from there, another kind of significant change in 98 and 2012. I mean, what we do see overall, the picture is that, prior to around, 2009, about 9% of claims overall were mental injury related. And then sort of in the subsequent 5 years, that jumps to about 11%. And then currently it's about 13%, and there's an expectation that this will sort of continue to rise up to potentially 33% in the next 10 years, arguably.
Yeah.
But in terms of working out those differences, I think it is difficult to. I think there's not only the systems different, but obviously there's a lot more stigma, a lot more other social elements that come into play. Back when a boomer generation was the age now of Gen Z. What we do know, though, from some of the data that we're seeing, and this is not claims related, but we have been doing there's been some interesting analysis come out around the different trajectories that those different age cohorts are sort of taking in terms of mental health, and I'll speak to some work I've done recently using a big data set, the HILDA data set, for anyone who's aware of that. It's a longitudinal data set, but some interesting work that's come out around that, using that data set, is able to sort of disentangle some of the elements that are, we know at a certain, as you sort of mentioned, mental health over the life course follows a pretty similar pattern. In terms of, it has some spikes into poor mental health, has some spikes in early adulthood, and then there's generally a improvement in mental health over adulthood, and then a decline in older age. That's generally the pattern we see. But we are seeing, when you look at the data coming through, we do see a categorically different trajectory being faced by some of those younger cohorts. So they're sort of falling off the cliff a bit more, if that makes sense. It's hard to do without a visualization, but where we're seeing that, arc, if we kind of think of, down being low mental health, an improvement, and then decline. We sort what we're seeing in the youngest, in that sort of Gen Z population, is that decline rapidly occurring, and the steepness of that decline increasing. So it's a bit hard to articulate, but they, as I said, sort of falling off the cliff when it comes to their mental health over that period, which is categorically different to what we've seen with some of the older generations.
So there's sort of, the trajectory is different, as you said, and instead of it kind of being more like this or more like this, or however, it's more like this.
Instead of being a slower, a gradual increase in arc, rainbow-esque, it's sort of very much a clear, much more of a drop off, a steeper drop off. So I think there is something to be said about the difference we're seeing there.
Okay. And can you tell us a little bit more about that sort of national data? You mentioned the HILDA survey that indicates about sort of the mental health among workers of different ages, and the changes and the differences that we've seen. You've mentioned a few already, but is there anything else around that data?
Well, I think maybe more interestingly, I'll speak a bit, I think, in a moment about the HILDA and some of the changes we're seeing in the relationship of work factors and mental health within the different cohorts. But if we look, so I've also been doing some work with the National Health Survey, which takes place every 3 years at a national level, and looking at, and I guess the value here, and sort of, it's a nice flow on from the indicators data that I was talking about, in that this is, I mean, the upside is this is longitudinal. So we have long-term data to look at. We can look at the patterns over time. I guess the issue with it is that there's a delay in getting that data. So the data I'm talking about is probably a few years old now. But there's the surveys don't take place so regularly and that sort of thing. But we're able to see patterns, which I think is the critical thing. And I've been looking at it's hard to work from that data. We don't always have actual employees, but we have employed aged individuals, so that working age individual. And what we're seeing, what I've been able to see within that data is essentially, overall, there's a general increase in poor mental health over across the board over the sort of last 20 years. Some of that's going to be about reporting and changes in, as I mentioned, changes in stigma, changes in issues around reporting. But there's other evidence to indicate that this might be a bit more than that. Data around sort of hospitalization for self-harm and that sort of thing, which kind of indicates that this is more than just being able to throw up your hand a bit. But what we're really seeing when it comes to the difference in the different cohorts, the different age brackets there is, if we break down sort of between males and females, this is really the young. There's a steep increase when it comes to the younger, that youngest generation, sort of that 18 to 20, 16 to 24 kind of bracket. That goes sort of through the roof when it comes to young females. It's a dramatic spike over the last even over the last 10 years. We've seen this really large increase there. I mean, we've seen high distress also significantly increase in other age groups too. As I mentioned, that group is probably the most significant. That sort of younger, that other younger female group beyond that of 25 to 34. We also see an increase, and then the older bracket of females. With males, what we're seeing is it wasn't so significantly different over that time period for the youngest, that 16 to 24 group of males, but then there's a considerable spike at the 25 to 34 age bracket, and then again sort of into retirement age. We again see this sort of upward trend there. So I guess that sort of speaks to the interest. Though there are these dramatic spikes happening and into quite, I guess, into a dangerous sphere when we're talking about young women. We are seeing increases in different other pockets that some can sometimes be forgotten about, but I think it highlights the trends that we're seeing overall, if that makes sense.
Yeah, it does. There's a lot in all of this. I'm mindful of time, so I'm going to sort of skim through a few other questions as well, so we do have time to go to some of the chat questions that come up as well. I guess what I'm hearing is, through all of this, to be kind of blunt about it, is, and this is more my own reflection, is it seems like, particularly at the moment, and maybe this has always been the case, and we'll talk about that in a moment, but it seems that the younger the generation, the more concerning or the worse the clinical outcomes, So I'll just park that thought for one moment. I'm going to throw back to Di just for a couple of minutes, just to talk about, I guess, can you talk us through some of the really unique challenges or opportunities that each generation faces, particularly in terms of workplace mental health? Just a couple of minutes on that one.
Yeah, sure, Steph. And I think it's really important to not lose sight that we should be thinking about them as challenges, more as opportunities, than challenges. And I think for Generation Z, the biggest challenge is perhaps the exposure to harmful workplace experiences relative to other generations. So 1 in 3 workers are being exposed to harmful workplace experiences, at least one in the last 12 months, like discrimination, bullying, work-related violence. And these are workers that in Generation Z that are working, more likely to work in customer-facing roles. So it's perhaps not a surprise there in retail, hospitality, for example. But
sorry, Di, I'm going to just cut you off really quickly. I really hate to do that. Your sound is I'm not sure if it's working mostly fine, and then occasionally it's just dropping out. So I just wanted to mention it. Sorry.
Let me
in case
see
it's
if I
something.
can.
You're fine at the moment, so I don't know if it's just a matter of maybe it's when you lean forward or back, or if you're touching something that's covering up
No worries.
a speaker.
Is that a bit better?
Actually,
I've just turned it up a bit.
That's actually really good. Yeah, thank you.
Okay, great. No
Sorry
worries.
to cut you off mid train of thought.
No, that's okay. Absolutely fine, Steph. It's better that people can hear.
Yeah.
Yeah, so on top of that, you know, being exposed to harmful workplace experiences, we're also seeing high levels of financial distress in our youngest workers, and loneliness. Nearly 1 in 2 report being lonely, and that's higher than the older generations. On the flip side, Gen Z, more likely to report taking action to support their mental health, which is good, which is really good to see. Generation Y are similar in some ways to Gen Z because they're showing similar levels of financial distress, quite lonely as well, and taking more action to support their mental health. But I guess for this generation, the opportunity lies more in supporting them through potentially some pretty big external life pressures. They've got a lot going on. So life work transitions, you know, experiencing parenthood for the first time, perhaps supporting, taking on a caring role for an aging parent, or going through a personal family crisis. So this is really comes to the fore in Generation Y. Generation X, skipping forward quite quickly, these are, I guess, workers that have the highest representation in levels of seniority within the workplace. They've got the highest workload. They report inappropriate workloads. They're also scoring high on the psychosocial hazard job control, so reporting less autonomy. I think a key finding for this generation is that 49%, so 1 in 2, report that the workplace caused their mental health condition or made it worse. Okay, so these are workers who report experiencing a mental health or mental ill health, and 1 in 2 of those individuals report that the workplace caused or made it worse. So definite room for improvement there. We've got workers with aging parents, which can be a burden. We've got female workers starting to experience signs and symptoms of menopause. So there's a lot, again, going on in Gen X. So that's a really quick picture. Boomer Gen, these are the ones who are working toward retirement. So this, you know, can be quite challenging as well.
Yeah.
So they're less likely actually to report high financial distress. But when they do, I guess those are the workers that are most vulnerable in this boomer worker generation. There's increased pressure to continue working, perhaps with inadequate finances at that point in their life. So our data actually strongly show that those boomer generation workers who are actively planning for retirement, who are also financially distressed, report significantly higher levels of psychological distress.
Okay.
Yeah.
That's all. It is a real. Sorry, you go.
No, I'm just going to leave you with one more thing, and then I'll jump out. So I think, you know, there are many unique features across our working generations emerging from our data, but there's also one, I think, really clear opportunity that is common across all of our generations. And that is that only 1 in 2 workers feel comfortable talking openly about their mental health at work. And I think that's a clear opportunity for workplaces to do better.
That is a really important point to finish that question on. And I think, you know, I've been taking lots and lots of notes. You know, whilst Gen Z have got the higher levels of claims, they're also taking action. Of course, we know that every generation has got challenge. Every individual has got challenges and risk factors, like you mentioned. Gen Y and Gen X have got, you know, Gen X have got the sort of life transitions and menopause and different factors. Gen Y, you've got the caring responsibilities. We can list and go through each generation and what their stresses are, which is not what we're going to do. I guess, and you're finishing on that point about the experience of the workplace and using and making and leveraging the workplace to be an opportunity to keep people well is really what we want to come to. And it's also a great lead into my question for Mark. So again, this all does suggest that your age, not just your age, but your specific cohort and your generation and how you were raised and your socialization plays a really big role in your mental health and your experience of work. Mark, what does your research tell us? I guess the question that I get asked occasionally is the workplace really a harder place than it used to be, or is it just that young people, aren't able to sort of suck it up like they used to? I think there's this sort of narrative that sounds like young people just aren't sucking it up like I had to when I was young. What does your data tell us about, is the workplace actually harder or not?
Yeah. It's a good question, and it is one that comes up a lot. And interestingly, I think this is probably that sort of one area that remains out there that seems fine to be this way about. It seems okay to be ageist when it comes to, it's okay to be ageist essentially, and I think that's somewhat problematic in this. It's unhelpful, I think, in this conversation, but it does come up a lot, obviously. And I mean, we were working on, in part, we wanted to sort of provide a bit of a response to that question because it does come up so much of what is it that's going on in terms of the workplace factors over time. And so again, we used a big longitudinal data set to do this. And so the key aims are really to look at, is the prevalence of the main factors we were looking at here were around job control, which is that idea of flexibility and autonomy in people's role, and job demand. And there's different models on these two concepts, but essentially they can work in tandem to create there are associations around poor mental health, especially where individuals have low control and high demands. That's sort of the worst kind of setup. But we wanted to look at whether those factors were sort of changing at a population level over time, and also then disentangling, and again with this sort of looking at the different cohorts, disentangling the strength of the association between the risk factor and poor mental health. So is that association changing over time? Well, over time, but also within those different cohorts. And what we found, well, in sort of answering that first question, essentially we saw small but statistically significant increases in the prevalence of employees reporting low levels of freedom when it comes to how they're able to, levels of freedom when they're talking about when they're able to work over time, and they have, and also lower levels in having a say in what happens in their job. We didn't see a change in the freedom to decide how to do their work. So that sort of that kind of the change in the when, but like declines in the when, but less in how. I guess then sort of digging a bit further, digging then into the job demand thing, we just in essence we found increases in job demand generally across the board in terms of a number of different questions around job demand, it being more stressful, more complex, a fear that it will make an individual ill, that sort of thing. But then when we then look at the next question in terms of what we're seeing at a cohort level, the different sort of, and for us, we sort of broke that up into, their birth decade, so 90s, 80s, 70s, 60s, and we could sort of go back down to the 50s with this data. We were able to, and again, this is a tricky one to articulate in a way, but basically what we're seeing was the effect of higher levels of freedom to decide when to do their work. So that kind of element of control was significantly less positively associated with mental health than in previous age cohorts. Similarly, this idea of having a lot of say about what happens in my role that was again significantly less positively associated with mental health in that younger cohort. So in essence, what we're seeing is the protective effects of job control. So historically, that's a protective factor, having more control. They're actually less linked to mental health outcomes. So essentially, you're getting less protection from this factor in these younger cohorts. On the flip side, younger generations are reporting their roles to be more stressful than they'd imagined. And they're reporting, them to be more stressful, but they're more significantly negatively associated with mental health outcomes. So essentially, they're having worse impact, and also this idea of a fear that my job will make me ill. That's also becoming more of a factor. So these are the job demand elements. So they're becoming more pronounced again in this younger cohort than previous cohorts. What didn't come up, interestingly, to answer your question to some extent, was it wasn't the same link with that element of with the question around my job will be more complex and difficult than I imagine, which sort of to an extent. So arguably, it's not a consequence of worse job conditions that we're seeing. It's a bit more complicated than that. In that sense, I mean, in short, I think we're witnessing a few things going on here, but I suspect it's largely driven by a more complex. I think workplace is one element of a much bigger puzzle, and we're seeing, drastic changes in terms of economic insecurities. We know, as Di mentioned, that's a big one coming up for younger generations. But social disconnection is also kind of critical, and others elements of the life juggle. I think a lot of things happened. I think the pandemic certainly sped up a lot of things we were seeing already.
Yeah.
I think there's been this acceleration of a number of risk factors across an individual's life that are playing out in the work environment as well.
Yeah, it's really interesting what you've just said. And we've talked a couple of times leading up to this webinar, and I know you're a researcher and you're deep in that research world. I find it really, really interesting. I'm just going to have a go at kind of paraphrasing what you said to make sure I've completely understood that. So it sounds like the jobs themselves are not necessarily more complex. It's not the work or the role type in and of itself that is causing the kind of negative kind of outcomes. And it's more that people, again, I'm seriously paraphrasing here as a non-research person, but it sounds as though for Gen Zs, for example, or Gen Ys, Gen Zs, there is a need or an expectation or a desire for work to be, what did I write down here? That there is a need for the workplace, for work to be a protective factor, and when it isn't, it's having a more negative effect. Whereas maybe for when a boomer generation, when they were younger and entering the workforce, there wasn't this expectation or need for the workplace to keep them well. I'm not sure if I've summarized that in a way that makes sense.
No, I mean, I think actually, Steph, to some extent, it's not. I think we're losing some of the benefits that historically work derived as basically that link between some of the protective factors of work is becoming a bit more tenuous, and whereas the impact of the demands is becoming a bit more ferocious. Yes, we didn't see that across all of them, but that's becoming more of a factor, and I suppose it doesn't, in a sense, doesn't totally answer the initial question in the way of, is it just because younger generations are more reactive to these pressures? But what we're definitely seeing is this element that that may be happening, but it may be also driven by a lack of the protections that have previously been there for some of the older cohorts.
Yeah.
A lack of the strength of the protections, if that makes sense.
The impact of the protections. It's really interesting.
Exactly.
I'm really mindful of time, and I had more questions planned for you two, and I could keep talking, and I have my own thoughts as well. I'm just going to quickly have a look at the chat to make sure that we have a bit of time for people in the chat as well. Somebody has written here, I'm looking down because that's where I'm getting the questions coming through to me. Thanks for your conversation today. Is there anything in difference in treatment outcomes and types of treatments that should be used for different generations? I'm going to quickly comment on that. I think when we're talking about, when it comes to treatments for mental health, that's probably not in scope of this discussion necessarily. We're talking specifically about the workplace. And when I've been talking to Di and Mark ahead of this webinar, and we were sort of, okay, so what? What are workplaces going to do with this data? What does it mean? Like, it's good to know, it's important to know, but okay, we want practical strategies for workplaces or leaders to take away from this webinar and these insights. And I think for me, and I'll throw to Mark and Di in a moment, but I think what it comes down to is similar to our general recommendations when it comes to creating a mentally thriving workplace and creating an environment that keeps people well. It's about trying to remove that stigma and assumptions and judgment when you're entering into the conversations with different generations, maybe identifying your own, if you're a manager of a certain generation, taking the time to reflect on your own unconscious biases that become conscious, and what you can do to kind of challenge those, and getting equipped with this data so that those assumptions can be challenged. If you're an older generation looking at younger generations wondering why people can't suck it up, well, there are factors. It's not as simple as that. In fact, it's not that at all. And so it's about taking that really human-centered approach to leadership and meeting your employees where they're at with what they need, with as much as it's reasonably practicable, of course. Mark, did you want to say anything about that in terms of, supporting different generations from a workplace context?
And I agree. I'm conscious of this being too focused. We don't want this to be too navel-gazing around the data that we're looking at, because the idea of doing that is to look ahead and well, what does that mean? What can we do about it? And I think not to get too far into the weeds of the different needs of the different groups, but I think you make a really valid point. It's around this acknowledgement and the inclusivity factor here. And I think once organizations and leaders are making genuine commitment, listening to the different needs of their workers, but and that they may be predominantly younger workers in some industries, there may be fewer in others, but I think listening to that, making that genuine commitment, I think there's data to indicate that some of the major issues in terms of psychosocial risk for younger workers is exposure to sexual harassment at work and poor psychosocial job quality. Like these sort of pivotal factors that have come out in a review. So I guess considering the impacts of harassment and bullying seems like a sort of no-brainer. There's difficulties, I think, in then how do you address some of these things. But I guess the critical aspect here is around looking at organizational culture and bringing in a whole of organization approach to create safe and respectful workplace. And I think that kind of goes to the broader issue here in terms of that you raise. I think when we talk about bullying and harassment, that's only one element here, and I think it's sometimes we see that coming out in some of the data around claims, because it's in some ways an easy lever to pull. If someone has that issue, then there's increasingly very clear steps to go down, and you move into a claims pathway if that's the way you go and whatnot. I think what's more complicated is this idea of stress and burnout and a lot of those things that Di was talking about earlier. I know that in Victoria that burnout and stress are no longer eligible for compensation, and it's that kind of and that stuff that I think is the really critical thing, and so I think it's listening there, being able to listen, and I think we're in a space where we can do that better. We can ask questions and not be afraid of getting the responses from workers, and we have the technology then to be able to look at those responses, code them, and work out what it is at various levels of at various levels of age or whatever across an organization, to see what the factors that are critically at play here are for the different different cohorts, and being able to act accordingly. So I guess it's really about making a genuine commitment, but listening to the voices within an organization for what is needed.
Yeah. There's a lot in that. I think I have lots of thoughts, and I was going to throw to Di. We're actually out of time. So I will wrap it up there. Superfriend have lots and lots of data on this. Myself and Di are going to be working on, sharing some of this data and some of these insights. So they'll be coming away in some form over the coming weeks and months. And if you do want to find out a bit more in the meantime, or more sooner than that, please feel free to reach out to myself or to Di. Thank you so much, Mark and Di, for joining me today. I know this is there's so much in this. I feel like we could probably have a follow-up conversation about much of this as well, a webinar on each individual generation if we wanted to. So I really appreciate us trying to wrap it all up into a 45-minute webinar. I appreciate your time. Thank you so much for joining. I believe Mel has put a link to a survey for any feedback you might have about our webinars, both for this specific webinar, but also so that we can continue to create topics that are of interest. So please let us know if you've got a particular topic you'd like to hear more about. Again, keeping in mind we have so much data, we can talk about loads of different things. So please let us know what you want to hear about so we can make it specific for you. Thank you so much. The recording will be shared in the coming days as well. So thank you, Di. Thank you, Mark, and have a lovely day.
Thanks, Steph. Thanks for the opportunity.
Thanks, guys.
Thank you.